This is a very, very important milestone today. The first AstraZeneca vaccination occurring in Murray Bridge, in regional Australia, in South Australia in particular. So I want to thank all of those who've been involved in this process so far. But this is the start of the next stage, the next step, as we begin to expand the rollout and ramp up the rollout. And in particular, I want to acknowledge the work of our doctors and our nurses, our immunisers, and everybody involved both in the Commonwealth and state systems for assisting. I would note there are reports today of one particular shipment from one particular country which has not been given authorised to proceed from the particular country, and the European Commission accepted that advice from Italy. We are very clear that this does not affect the pace of the rollout. That shipment had not been factored in to our distribution to the states and territories, and in fact we received the first shipment of AstraZeneca this week of 300,000 doses, and AstraZeneca has a deep, broad global supply chain, and we have indeed been reassured that they will continue to draw on that deep, broad global supply chain. So I think that's important reassurance for every Australian. It is a reminder, it's a very, very, very competitive world, and that is precisely why we ensured that we had sovereign vaccine manufacturing capability with 15 million AstraZeneca vaccines to be made by Australia's extraordinary CSL, to be made in fact here in Melbourne, and that is expected to ensure doses to be made available from late March. I've had reaffirmation overnight that that remains on track in the order of 1 million doses per week, which will be made available. Obviously, contingency is then taken from that for second doses, but that will allow a dramatic scaling up and the commencement of the Phase 1B program. To provide an update, before I get to the Phase 1B program in particular, I should note that we have, on the advice I've just received from the National Incident Centre, had 0 cases in Australia. There are still a couple of jurisdictions to provide a final report. Assuming that remains the case, and we believe it is, that will be 35 days this year with 0 cases of community transmission nationwide. And sadly, there have been over 440,000 cases worldwide in the last 24 hours, and over 9,000 lives lost in that period. With regards to the vaccination program, by the end of today, we expect that there will be over 260 aged care facilities which will have had vaccinations carried out, and we thank all of those older Australians, our elders who have put their shoulders forward, as have so many others, and everyone involved in that process. That will mean over 20,000 aged care residents that were vaccinated to last night, and more obviously today, and as of yesterday evening, with final numbers to be confirmed by some jurisdictions, over 71,000 Australians vaccinated. I would note in particular that today we are writing out to over 4,000 accredited general practices that have applied for participation in Phase 1B, confirming that they have been accepted, confirming the progressive rollout dates so as to make sure that we bring them on in a safe and cautious way, beginning in late March, and they will then respond and acknowledge, and so by mid next week we'll have confirmation from all of those as to their willingness to participate, but all of them applied, and so we have been focusing on what are called accredited practices with the strong, deep support of the Royal Australian College of General Practices, the Australian Medical Association, and the Australian College of Rural and Remote Medicine. The medical leaders have been real leaders during this process, and they were very keen to ensure that we had the highest standards and the broadest participation, and the participation is broader than our best expectations. And so I think that's great news. It means as many Australians as possible, as broadly across Australia, will be able to be vaccinated by their own GP. But there'll be a variety of options. The states will have their vaccination clinics. There will also be the Commonwealth vaccination clinics where currently people are able to be tested, what are known as the GP respiratory clinics. The Indigenous, Aboriginal community-controlled health organisations and the Pfizer hubs, which the states are running, will all continue. And in time, we will have the pharmacies also join us. And so I think that's very important. So that indicates that Phase 1B, which is due to start in late March, is on track. And indeed, we have indicated to the states and territories that if they so wish, they are able to bring forward the health worker component of Phase 1B. That would be slightly ahead of schedule, and I understand a number of states and territories are considering that, and it will be up to them to make their own announcements. But there is the capacity for Phase 1B to start early, with some states and territories actively considering that. So all up, I think these are very positive developments. The first AstraZeneca vaccination today, the rollout to the general practices of information regarding their participation, and next week they'll respond, and the continued increase in the number of aged care facilities, aged care residents and Australians overall that have been vaccinated. I might start firstly with those that are online and then come to those in the room if that's right. Rachel?
Thanks, Minister. So on the delayed shipment, you detailed earlier this week how many doses of the vaccines each state and territory was getting. I think it was 86,000 for New South Wales, 76,000 for Victoria over 10 days. Does this shipment delay affect that number? Will the states be still getting the same amount of vaccine doses?
No, it doesn't delay. This shipment was not included. We only include those doses that are actually in hand. And one of the things we've learnt, whether it's through the import of masks or test kits, whether it was through the construction process of ventilators, where obviously parts were required from overseas, although the construction was done in Australia, and through the vaccination program, is to be very cautious in terms of international arrivals. It is an intense global environment, and having the sovereign vaccine manufacturing capability is immensely important. But those distributions, which were announced, and indeed the first of the actual deliveries of AstraZeneca has occurred, as we can see in South Australia today, are unaffected by this and were based on vaccines in hand in Australia, and our forward projections did not involve this particular shipment of one set of doses from one country from a firm which has a deep, broad global supply chain, and that was reaffirmed to me only this morning by the country head.